My son was a good kid. He was really smart, very funny. He wanted to make something of his life when he grew up. He never made it home.
On October 10th, 2020, Laura Shanafelter got the call no parent ever wants.
I just fell to the ground.
Her 18-year-old son, Tyler, died of an overdose traced back to fentanyl.
He thought he could try the drugs, that he could do it without becoming addicted. And unfortunately, you can't.
Shanafelter's son is one of almost 5,200 Pennsylvanians who died of an overdose in 2020. The opioid epidemic in Pennsylvania peaked 3 years prior in 2017. However, it's since evolved to an overdose epidemic due to an unseen killer, fentanyl.
The substances that people are using are absolutely deadly.
Fentanyl is a synthetic opioid up to 50 times stronger than heroin. Experts say it's infiltrated the drug supply, making the drugs cheaper and more dangerous.
You will die. It's not a question of if you'll die anymore. It's a question of when are you going to die now.
While overdose deaths fell in 2018, they jumped back up in 2021 to 5,300. 78% of them involved fentanyl. The same is expected this year.
And that's really devastating because you're really talking about losing 14 to 15 Pennsylvanians every single day, year over year over year.
The decriminalization of fentanyl test strips in Pennsylvania gained momentum in the state legislature this year, a somber success in the eyes of advocates.
It took the loss of so many Pennsylvanians and the impact of addiction on families to reach the magnitude that it has to really start making a difference.
Pennsylvania joins over 30 other states in legalizing the harm reduction tool. Pennsylvania state law previously classified fentanyl test strips as drug paraphernalia. It blocked federal dollars from coming to the state to support these test strips, which are designed to check drugs but have been criticized for enabling users.
The reality is that people who use drugs are going to use drugs, whether they have access to fentanyl test strips or not.
At least you would know that those drugs are not safe.
To better understand this, we came to Philadelphia, which has become the epicenter of the epidemic in Pennsylvania.
There's a lot of need.
Philadelphia leads the state in overdose deaths, with almost 1,300 deaths reported last year, the most it has on record. Fentanyl was found in 77% of them.
This is absolutely a crisis.
Charles Nolan has been on the front lines of the crisis alongside his team at the Philadelphia Health Department.
We do a lot of street-based outreach, talking to community members, asking them what they need. We distribute naloxone.
And for the last year, they've also distributed fentanyl test strips, with Philadelphia and Pittsburgh decriminalizing them before the rest of the state.
With dope, there's always some degree of fentanyl in there.
We met with Nolan on the day the test strip bill was signed into law. He showed us how they work.
There's going to be a lot of filler and little spots of fentanyl. Rub the halves together and little bit of the pill sprinkle. It's going to take about 30 seconds to give us a reading.
2 lines means no fentanyl is detected in the substance. If 1 line shows the substance is positive for fentanyl. By 2023, the rest of the state should have access to these test strips too.
It's not just a Philly problem anymore, and sometimes we hear that. Fentanyl is an issue in every county across Pennsylvania and in every drug supply.
But for so many, irreparable damage has been done.
This is the last picture of my family that we got to take together.
You think about the impacts that that has on families and communities.
We've lost our future when we lose our children.
2 years after his death, memories of Tyler are on display throughout Shanafelter's home.
Sleeping across the hall from that room, knowing that no one's ever going to come back. It's just hard. When that dealer took my son's life, they took my life too.
Shanafelter taking that pain and using it to raise her voice so other families don't feel the same loss.
I want to make sure that his name will live on forever.
Experts say these test strips are just one piece of the puzzle. Different methods work for different people, and they say every single method we use gets us one step closer to solving the crisis. For CBS 21 News, I'm Samantha York.